this is not me. I hear this from patients. I haven't been myself, but they don't have perhaps the words or the vocabulary to, articulately present their symptoms. As a child grows up, the environment that the kid grows up makes a lot of difference in how their psychological makeup is. And hey, I'm not feeling great today. Do you want to go for coffee? Hey, let's do this. People who you can trust. What we have to understand is for the mental health, to have someone in a sound mental health, there needs to be a nurturing relationship. It doesn't matter who. It doesn't have to be your blood relations, because sometimes it also happens that people are in a very toxic relationships within the family.
Hello and welcome to Nepal Talks presents Keep Talking to Ananta, where I aim to present you successful entrepreneurs, small business owners, and influential personalities so you can get inspired on an everyday basis. Today, I have an extreme pleasure to be in conversation with someone who we need the most. She is Dr. Sushrusha Aryal, and she is psychiatrist. She is a sleep specialist. She is owner and CEO of Bliss Sleep and Psychiatry in Morrisville, and she is a former assistant professor at the Duke University School of Psychiatry, School of Medicine?
School of Medicine.
School of Medicine.
Yeah, until December 2024.
Fantastic. Thank you, Dr. Aryal. Thank you for accepting my invitation. Welcome to my podcast.
Thank you for having me here.
Let's first begin with your area of expertise. What do you do? Why, do we need the psychiatrist, and who needs a psychiatrist? Let's begin with that.
Okay, so I am a physician. I have MD degree, and I am board certified in psychiatry, and I am also board certified in sleep medicine. So I'm a sleep physician as well. So to your point, who needs a psychiatrist? See, mental health is extremely important, and now we're becoming more aware than perhaps 10 years back, right? People are talking more about mental health. People are becoming more aware. People are pursuing treatment if they are not feeling well. There is less and less stigma, as I see. So absolutely, mental health is very important, and a psychiatrist can treat people with medications and with non-pharmacologic methods. We call it, therapy. We can also prescribe medications, and we can also prescribe sort of, a walk, let's just say. I do tell my patients, go for a walk, do some exercise. We can help people elevate their social support, build the social network, because all of that is overall connected to their mental health. So people with anxiety, people with depression, people who have been diagnosed with bipolar disorder, people who have schizophrenia, or, someone who does not have, let's just say, day-to-day, a very stable mood and feels like, something is not right with me. I just need to see someone. That's who'd come and see the psychiatrist.
There's really a gray area where, we tend to, divide between whether or not I need a help in terms of mental health, right? What is the trigger? Or if there is even a trigger that tells me I need a help, how do I identify that?
So to answer this question, we will need to understand mental health is a very, very broad subject, right? Most common illnesses, if we say in our day-to-day life for mental illnesses, would be depression. So what would be the symptoms of depression? If you'd feel sad, and, day-to-day sadness, when there is a trigger or there is a problem overall, if you lost someone, if you lost your job, those are triggers, and people do feel sad. But if that lingers, there are symptoms of depression, like sleep disruption is one of them. Losing weight or gaining excessive weight is another. Feeling extremely fatigued, if you don't have any energy to do anything. Being very disinterested in things. And technically, for major depressive disorder, you have to have these symptoms for 2 weeks. And there are very many, symptoms that you can, we call it like DSM criteria. There are very many symptoms that people can fall in different categories. But for the level of education for general public, if you feel like, this is not me. I hear this from patients. I haven't been myself, but they don't have perhaps the words or the vocabulary to, articulately present their symptoms. It is okay to ask for help. Similarly, there is a very common illness in mental illness is anxiety. So if you have a lot of anxiety, out of proportion, a little bit of anxiety is sort of expected.
So basically, there is a trigger that I am aware, well, I will be aware either through my own consciousness or through the communication of my family members. There is some sort of, difference that I should be feeling before I need, I seek out for help, right? That different, that, the problem, the issue, is that because of the social, elements that we go through on an everyday basis, or does it have to do with the, our DNA? Does it come with inheritance? Does it come with anything else?
When we have to understand any kind of psychiatric illnesses, we'll have to understand that there are three basic, like the three corners of the triangle, right? One is the biological makeup that you are talking about, right? The genetic, like a family history of schizophrenia, maybe family history of alcoholism, family history of other substance use disorder, family history of depression, history of suicide, especially, that puts people more at risk. And then there is this psychological makeup. So what it is, as a child grows up, the environment that the kid grows up makes a lot of difference in how their psychological makeup is. And you could just put it as simply as how their resilience is built. If someone has been brought up in a very traumatic household, someone who has been a witness to domestic violence, someone who has been abused, a kid who has been abused, they will never have that kind of psychological sort of resilience compared to the kid who has grown up with, let's say, loving parent, right? So that's the psychological aspect. And they are more prone to, developing anxiety, depression later in life. So that's the psychological aspect. And then your day-to-day, right? Your social aspect. So that's the third corner of the triangle. So social aspect doesn't mean like you have to have hundreds of friends. Social aspect means people need to have meaningful relationships. Relationships where you can pick up the phone and say, hey, I'm not feeling great today. Do you want to go for coffee? Hey, let's do this. People who you can trust, not your followers or admirers, but your friends in real sense. So that makes, and it can be, not just friends, can be your spouse, can be your children, can be your other relatives, can be your mentor, can be anybody really that way. And that extends to professional support as well. And that's why therapy works, right?
That's why Dr. Aryal
Thank you.
comes into play. That's where exactly you come into play. But, most of the problems, most of the issues, mental health issues, those, originate from our relationship with others. Like, I'm having a bitter relationship with my spouse. I'm having a bitter relationship with my friends, with my kids, right? How do I identify which relationship is good relationship for me? Navigating away from those issues in an early stage.
So it is not very simple that way because, see, human mind is extremely complex. And each individual, I feel like it's like we're like art, right? Each piece is different than the other, right? So it is not like we can suggest you should do this or do not do that, because that's specifically in therapy. We do not say, oh, you have to do this, you don't have to do this, you shouldn't do that, unless it is a safety concern, of course, right? So that is for the own individual to navigate. It is his journey or her journey to figure out, how to. And that's where, again, so there is a psychiatrist who can prescribe medication, do therapy, but there are psychologists, people with PhD degree. I have MD degree, right? They can help you sort it out through therapy, and it is a process. It is a process of first finding yourself, then knowing where you are in the relationship, and then trying to redefine that.
Okay. One of my friend, I would like to, bring in a context here. One of my friend had a very troubled past, and she wanted to go to a psychiatrist, and she went back in Nepal. And she was told that it is because of her, issues, if it is actually her fault to be in that situation. And she was actually bullied by the psychologist itself. And now she has a completely negative, thinking about those mental health professionals. Okay, what is the responsibility of a mental health practitioner like you in consolidating the issues, the problems, whatever your patients are going through? When somebody walks to your door, what is your first responsibility?
So first of all, I'm very sorry that happened. I mean, that should never happen to any individual who's, because now what has been done is like we have completely shut her, any kind of like access to care perhaps, right? Because, so that shouldn't have happened, first of all. The responsibility of a psychiatrist, and for that matter, any physician or any other healthcare professional, even if they are not physicians, they are psychologists, they are medical assistants, physiotherapists. Our job is not to tell the patient what to do. Our job is not to say, okay, you're right, or this is right and this is wrong. We see ourselves as, and this is something that my program director, my very he was my program director and mentor. He used to say, you guys are jungle guides. Mm-hmm. So we are like someone who would help them navigate their journey. It is not about us, right? It is about them, to navigate themselves and facilitate the process with our expertise and knowledge. So to answer your question, the first and foremost that any individual should do as a healthcare professional is to validate them, to empathize with them, to see where they're coming from, and then try to use your expert opinion in that whole process and see where it fits and how should it be, how should we proceed together as a team.
We've touched about family situations a little bit, but let's dive a little bit deeper into what is the importance of family communication in mental health well-being.
Yeah, no, see, it is extremely important, but what we have to understand is for the mental health, for to have someone in a sound mental health, there needs to be a nurturing relationship. It doesn't matter who. It doesn't have to be your blood relations, because sometimes it also happens that people are in a very toxic relationships within the family, and it's kind of, think about it like as an emotional bank account.
Emotional bank account.
Yeah.
I like that terminology.
Yeah. Like you don't want to just keep giving let's just say the currency away. You want someone to put the currency back so that you're not in a negative balance, right? So mental health, a sound mental health depends on not just who you interact with, but what kind of interaction do you have? It has to be nurturing. Someone has to be keeping some, okay, yeah, if you want to withdraw $100, do that. But make sure you put at least 10, 20 here and there sometimes, right? And that's how relationships are.
That is a great analogy I'm now that starts fascinating me. A relationship, a healthy relationship, is a relationship where not only you are getting something, you're also providing something. So I'm in a relationship, and if I'm constantly looking for emotional support from my better half, that person might get tired of it, someday, right? In an instance, they may not have the energy to give you all what you want, what you expect, because they're also going through their own life. It's their own journey as well. So trying to give something that even he or she may sound so healthy in terms of mental health issues, trying to give away something that you may have, you don't realize, to other person may actually bring in some positivity within yourself.
That is true. That is true. Right. So see, altruism, we call these like positive, like very strong defense system, right? Humor. Humor is a great mature defense. Meaning if you can turn the situation around and laugh about it, that's awesome, Similarly, altruism means giving, the act of giving. It makes you feel good. Yeah, altruism means the act of giving selflessly, But one has to be extremely careful of their emotional bank account, You can only give what you have. Right.
That is the point. Okay.
So it's good to give, but you have to have something to give.
That's fantastic.
And,
That's fantastic.
And to add to, if you don't have that, then you have to find people who can fill your bank account, who can nurture and bring you to the point, and it could be anybody again,
But again, in that situation, Dr. Aryal, what I think is, so see if I'm going through issues, right? Now, I don't know if I have a negative energy, if I have a negative balance to your calculation, if I have a negative emotions. I don't know, because I think that I'm right. I'm 100% right at all time. Who needs to tell me, or how do I identify if I'm having that negative balance? How do I identify, and what would be my first step in order to bring that into at least in a break even?
Yeah. So, so gratitude, right? If suppose like you are always feeling very sad, you're feeling like you're extremely anxious, you're feeling like, you don't enjoy anything in life, you're feeling like, the extremes of these could be, my life is not worth living. It might not be even like, I want to kill myself. That is called active suicidal thoughts. It might just be like, hey, if I don't wake up tomorrow, I don't think anyone will miss me. We call that passive suicidal ideations, Or if you kind of, go to, alcohol or drugs to kind of numb your emotions. If someone a loved one is saying, hey, you are not yourself, there is something wrong, you should seek help, please listen to them. Listen to your body tells you, why am I so fatigued? Why am I not interested in, let's say, photography? I have loved photography all my life. I've loved doing podcasts. Why am I not interested? What's wrong with me? When you start questioning yourself, when other people start questioning yourself, that's the time to seek help.
That is great. Thank you, Dr. Aryal, for your time, for your insight, for your experience, and everything that you put forward. We will definitely be in conversation with you again and again, because this is an area where I think we need more and more information. There is not enough conversation about this, especially in the community that we live in today, surrounded by the jargons of social media, information, over information, loaded with a lot of things that we cannot handle anymore. I think, talking about this and communicating this, and even seeking help with an expert like you becomes, so a necessary item as of now for our society. We will be in conversation with you again. For now, thank you very much for your time.
Thank you for having me here. It was a pleasure. One last thing I want
Absolutely.
to tell
Please, go for it.
everybody is, one thing that if we can get out of like what we are talking today is, if there is nothing else, there is no support system. Suppose, right, for someone, you have nobody to reach out to, please reach out to nature. Nature heals. It heals us. So I'll leave you with that note, and thank you so much for having me again.
Fantastic. Thank you.